Hello, my name is Jasmine Blake and I am speaking to you as a psychotherapist. Earlier today, an individual came to me about a deeply set fear that they have of spiders. The name of this immense fear would be arachnophobia. Now, this individual has expressed that they are so afraid of spiders that they are afraid of going outside in grassy areas, which is difficult as they reside in a rural area. They also expressed that they stay up all night worrying that a spider may get them in their sleep in their own home, and also sometimes feel as if a spider is somewhere near them. When it comes to treating this patient, I've decided to take the psychoanalytical approach. By using this approach, I will place the focus on the unconscious mind instead of the conscious mind to see if we can get to the root of that fear. One of the key members of this treatment, American psychologist Albert Ellis, stressed the importance of thoughts, feelings, and behaviors and devised a theory called rational emotive behavior therapy, which is the earliest form of cognitive psychotherapy. Then, somewhere in the 1950s and 1960s, American psychiatrist Aaron T. Beck noticed that there was a pattern with his depressed patients. To him, they seemed to not only hold negative thoughts about themselves, but also of others and the future. This caused him to research whether or not holding negative views may be part of the reason someone is depressed. The modality that I've chosen to help this patient is cognitive behavioral therapy. Now, CBT focuses on the specific thoughts and beliefs that you have associated with the phobia. When you encounter a specific fear, you may have a habit of imagining the absolute worst will happen, which can amplify your anxiety. With CBT, you can identify the cognitive distortions. I feel that this would be the best approach for the patient because it can help them notice the thoughts are ramping up their fear. Help them to replace the inaccurate thoughts about the statements that are more realistic, and remind themselves that what they are experiencing is a fear. My patient would benefit greatly from this form of treatment, and it is a good first start. Now, for a moment, I want to discuss fate versus free will. Free will may refer to our exercise of free will when we perform actions in the present. Fate refers to the sum total of the effect of past actions that influence our present life. Fate is sort of like our destiny. It is the destined fate of whatever we may do with our free will. We all have choices in our lives. The choice to make good decisions, the choice to make bad decisions, the choice to handle our problems, and the choice to run away from our problems. We all have choices, and those choices are made using our free will. I guess I could say that we are the masters of our own destiny. If you are having issues with your behavior, decision-making, or any unresolved trauma, it is better to get help for it. If the objective is to have more control over your life, it's for you. Be a better you.